Hello, I'm Dr. John Preston Parry. I am a board certified reproductive endocrinology and infertility specialist, and welcome to my YouTube channel. I'm going to be talking about sperm, male factor. What do you need to do to have the best sperm possible? And guys can set themselves up for success with pregnancy. Again, everyone assumes that it's all on the woman, and certainly women have a lot more on their shoulders, but it takes two to tango. So if you're interested in learning more about how sperm can affect fertility, watch, like, subscribe, share. Let's dive into it. What are the signs of healthy sperm? The truth is, there is nothing you can do looking at your own sperm to really figure that out. Almost impossible. You really need a microscope. It's kind of interesting. If you take a guy and perform a vasectomy, a month later, the ejaculate will really look the same. Only 10% of the volume in the ejaculate is actually sperm, and 90% comes from the prostate and seminal vesicles. So again, you could go from 100 million sperm down to zero, and you can't tell a difference looking at it. Now, obviously, if there's strange smell, color, odor, certainly if something has changed from equilibrium, if it burns, if there are other problems, you may want to get that checked out. But at the same time, people can have completely normal ejaculate and have no idea what it is. So you need kind of professional help. Now, some people say, can I check my sperm health at home? It's not that the tests can't work, but I've seen a lot of times where they're not reliable. And I've had people told, yes, they have plenty of sperm, only to find that they're nearly firing blanks. And so I don't entirely trust the tests. Also, for us, at this time, the cost of a semen analysis is $75. That's often the cost of a home test. And I can tell you, having a professional look at things and be able to give more details and nuance, that's a lot more powerful than the home tests, which, again, just have some problems. What are the signs of unhealthy or weak sperm? So, first, you have to say, what do we care about for sperm? And you look at a couple things, and it's really the quantity, so how many sperm are there, the speed, how well they move, and then you can look at the volume. So again, is there a lot of volume or low volume? And then how do they look? The morphology or the shape. Now, for the volume, the more volume there is, the more sperm potentially could be there, but not always. People think a large volume says, oh, I must be virile. And no, again, sperm are pretty small. And so it depends. And in fact, some guys can actually have, when they have a lot of volume, a prostatitis or some inflammation leading to that higher volume. It can actually be too much. And so you do want to know whether that's the case. You then look not times just the volume, but how many sperm are in that volume, so that you usually count it in millions of sperm per milliliter. And then you're looking at how many of those sperm are moving. And not all sperm are moving. They've often outlived their shelf life. That's okay. But you're often looking in the 60 to 80 million total motile sperm range. If you drop below 15 million total motile sperm in an ejaculate, that's actually considered abnormal. Now, you can have one guy with 14 and another with 16. There's no difference between the two of them, effectively, even though one's technically normal, one's abnormal. The reason we care so much about sperm numbers for moving sperm is it takes 10 million total motile sperm that are progressively motile, so not just twitching or flailing about, but progressively moving forward. It takes 10 million in an ejaculate for one to find an egg. So if you've got 80 million sperm, 8 sperm find an egg in a month. And if you've got 8 million, it might not even be one. If you've got 0.8 or 800,000, it might be once a year a sperm finds an egg. So those numbers actually do matter. I still think it's far more common to find female factors. I think there are a lot of guys where they've been told they have male factor, and it's really subtle and not changing the management. Women are more involved in the process. They have a lot more that can go wrong, but I can't tell you how many times everyone assumes it's the woman, and it's the guy as well. What can you do to make sperm stronger? Honestly, not very much. Now, again, if you are taking a calcium channel blocker, which can interfere with the sperm binding with the egg, that needs to be changed. If you're taking gout medication, a lot of gout medication is toxic to sperm. Some have even argued cholesterol medication can interfere with the DNA synthesis. So you definitely have to look into that. And by the way, that can cause many cholesterol medications cause severe birth defects when women are taking for things. In terms of just general wellness for sperm, though, first, a lot of people sell male prenatal vitamins. Most of them are vitamin E, zinc, and a multivitamin. Um, I'd make my own from GNC, not endorsing any particular brand or anything like that, but I'd make my own. Save yourself some money because it's not clear that it radically shifts or even at all pregnancy rates. If there is smoking, stop smoking. If there's alcohol consumption, more than a drink a day, there's data saying that eliminating all tobacco and dropping to one drink a day improves pregnancy rates. It's not all or nothing, but you want to stack the deck in your favor. One of the things that I hear people ask about for sperm is, can you boil your sperm? Now, obviously, sitting in hot tubs hasn't killed off all the Scandinavians or, people in Wisconsin. So, and, for really tight underwear, I don't know, sometimes in the tighty whities, your wife sees that, she might start laughing and you may not have the opportunity to conceive. But for the most part, I think we overemphasize those things. The reality is, yes, if sperm are boiled, you can see guys lower their counts fairly quickly. There was a study where they gave these guys underwear that elevated scrotal temperature by 2 degrees for 16 hours a day. They did this study in France, and it took guys from 80 million sperm down to zero. So, yes, if there's an extreme of heat, but then short bursts occasionally usually don't do that. So I'm underwhelmed by the data saying this is a major source of male fertility. Enjoy the hot tub responsibly, but at the same time, it's probably not the source. And if you think it is the source, you should get evaluated. When should you see a doctor about your sperm? Honestly, I'm much more of a simplistic guy on that. I just think if you can get a semen analysis for $75, or again, some people are more, and if you're paying $750, that's way too much. But if you can get it for 75, which we tend to do, that's I think that's much more reasonable. Just get the result and get the answer. And then if a problem's found, then see a doctor. But it usually when I'll refer to a subspecialist for a male urologist is when the numbers are so low we can't do things for insemination, or if a guy is nervous and just wants to find out more. So if you think you need evaluation, consider it, but it may be good to just confirm where you are first. One thing that's an interesting difference between men and women is women are born with every single egg they'll ever have, while men make new sperm every single day. It's kind of unfair, a little bit different. But it takes 90 days, both for sperm and eggs, actually to go from sort of a quiet stage to a functional stage. The reason that 90-day rule, and some people argue 78 or 75, but ballpark 3 months. The reason that matters so much is people say, well, hey, next week I'm going to do an insemination and try to get pregnant. I'm going to stop smoking this week. And no, it's been exposed to tobacco and nicotine and all those things for months before. So you really often want to cut back or stop things that have a negative effect 3 months before trying to get pregnant. For example, steroids. Guys taking testosterone, good example. It takes 3 months for the sperm to fully recover when a guy stops taking testosterone. Can lifestyle and change or improve male fertility? You know what? Most of the time, no. If we could get it wrong, we would have died out. But at the same time, again, weight loss, smoking cessation, alcohol reduction, those all do matter. You are what you eat. The baby is what you eat. Watch what medications you take for things. But at the same time, most of it, if you're starting to worry about sort of lifestyle or nuance, usually that's not the source. Again, a lot of information, short period of time, like, follow, subscribe, share. And if you want to know more, just Enter it in the comments below. We'll answer anything and everything we can. Remember, this is general medical information. Always confirm whether things apply to you or whether knowledge has evolved with a clinician before coming up with a plan of action. And hopefully anyone watching this who wants to be a dad actually will be. Thank you.